Good afternoon, everyone. I am Kelly Jones. I am a health educator with Cook County Department of Public Health, and I am your facilitator and your organizer for our CCDPH monthly school webinar. Thank you for joining. I know that some people are on spring break and some people would just rather be out enjoying the sun, so we'll get you through it. Our agenda is today we have our welcome announcements, little housekeeping, our update from our communicable disease unit, an update from our partner at Respiratory Health Association, as well as a presentation from the Epilepsy Foundation of Chicago. Let's get started. Our objectives are to keep you all informed, give you the most up-to-date information and guidance, share resources, access valuable tools, and share events in the community, and provide support to our school community and staff in order to help keep you safe. Please mute your lines. And if you have any specific needs or anything, please let us know. Feel free to put any questions in the chat. And so you are aware that the webinar will be recorded and uploaded to our CCDPH website, as well as our YouTube page, and the slides will also be uploaded to our website. We've been asked for the slide deck, and I used to email them. And a bad problem to have is we got a little too big and I couldn't send mass emails with the slide deck. So now they're uploaded onto our website and you can download it and look at them at your leisure. A few announcements. Our registration for our next series of webinars is updated on our Cook County Health Department website. You can scan the QR code to get to that series of webinars as well as view previous recordings. And you can sign up to receive our school health newsletter, which has additional resources and information shared after our webinar. Please join CCDPH at our school health webinar next month, April 17th at 2 p.m., where we will have partners from the South Suburban Special Recreation Association. So please join us with information from that, as well as the American Red Cross will talk to us about preparedness issues in schools. My great embarrassment is that the CEUs from our conference has not been sent out yet, and I apologize. I don't know how many times I can apologize. I just spoke to our partner at Hartgrove earlier this week, and she didn't know they hadn't been sent out. The staff member that she assigned to send them out quit, and she didn't know that they weren't sent. So she's working on that. I will follow up next week to make sure that it has been completed. Please feel free to continue sending me updates to let me know you have or have not received it so that I'm aware and I can finish this and make sure that everything's taken care of. Here is our CCDPH contact information. If you just have any general questions, or if you'd like to report any line list, if you'd like to access our CCDPH website, our school-specific page, and if you'd like to request allergy and asthma resources, as well as request prescriptions. For those who may have attended our Data Ambassador workshop, it showed you how to manipulate the data, and you can use that towards grants or finding out basics of health equity and population health for schools and communities alike. You can use the QR code to download that toolkit to help you further in your studies. Few resources. As I stated before, if you'd like to request prescriptions, I am no longer the contact person from that. You can submit all questions to the CCDPH undesignated medication at cookcountyhhs.org, or there's a link on the website for you can request, send questions or request that prescription. If you are automatically enrolled into the Rescue Illinois program, then you can reach out to their contact to find out any questions that you may have regarding that, because those people who were automatically enrolled just automatically received that materials. And if you have any questions, you can contact them with that. Jessica Yee is now the contact person for naloxone requests through CCDPH. You can contact Jessica at the email address on the screen, or there is a link on the website in order to request those kits. CCDPH has restarted our hearing and vision program. We are slowly starting with ages 3 to 5 and hope to expand to school age children. If you'd like to request them at an event or at your school or preschool, please use the email address at the bottom of the screen to request them. Our free flu and vaccine clinics are ending at the end of the month. You still have a couple more chances to get that if you have not gotten that. Even though the flu season is almost over, some diseases are still floating around. If you haven't got it, or you're likely to have you're likely to get infections easily, please make sure that you get yourself vaccinated. We had a representative from Orland Park here last month to talk about their vaccinations. They are now VFC providers and they can provide vaccinations. And here are the dates and the fees for their vaccination schedule. Coming up next month, it is very limited spaces from, I forgot the college. Let me see if I can find it. I'm sorry. It's up on my screen. I can't see it. Let me move this. Harper College. Sorry about that. Harper College is having a second annual Kids Smile Day. It is free, only on April 11th. They are very limited, and they said they are small programs, so first come, first serve. And once those slots are gone, that is it. However, they do have a hygiene clinic that they host, and they just do minor procedures such as cleaning, sealants, and bite wings for adults and for kids. And there's more information on their website. This is the time of the year that schools and other community organizations are trying to do vaccination resources for next school year. So if you'd like to retain any of these organizations for your event, this is the time now to request them, as their schedules fill up very, very quickly. Few mental health resources. I'll zip through them. These are the same that we've been sharing. We just want to make sure that information is readily accessible. All of the information as far as 211 NAMI and 988 all on one slide. But these are the individual flyers for these programs. NAMI has teacher-specific resources that they can share, as well as they have their spring family to family cohort that is starting next week. Here's some more crisis information and mental health supports, as well as Maine Township has a program that's free or low cost, which includes counseling services. Some community resources. Providence Scholarship Fund application opened on March 12th, and it ends on April 19th, and it provides a $10,000 or a $20,000 scholarship, depending on your educational attainments, and you can find information on the QR code. If you are a current or former DCFS Youth in Care, they also have a scholarship. You can find information at that QR code. And a few more scholarships. I'm sorry, let me just move this out of my way so I can see a few more scholarships that are available. This one ends next week, as well as a scholarship from the Coalition to End Homelessness. Some resources from our partners at CETA. Information on SNAP. As we know, there's been some cuts, and a lot of people have food insecurity. So information on those cuts and how you can find resources, and information on pantries to support families who've been impacted by those cuts. And this QR code has a link to a list of suburban pantries that are not listed on the previous slides. If you know some people who could use clothing, this monthly outreach for Suburban Outreach Access has clothing drives, for a free bag of toiletries, as well as clothes is handed out. And if you see fit and you have clothes to donate, please send them there, as they are collecting items as well. Upcoming community events. If you are in Maywood, or you know a child who lives in Maywood and they are seeking summer employment, Maywood has now started their hiring for their summer program, and you can scan the QR code to get more information, as well as the Forest Preserve. This one is only specific to people who are voucher holders for the Housing Authority of Cook County, ages 14 through 19, currently in high school or recent graduate. However, there are internship and opportunities for the Forest Preserve, as well as there's a teen resource fair through the Park Forest Neighborhood Network in the Village of Park Forest has vendors and some supports for those who are seeking careers and need some supports, as well as Bloom Township also has youth employment applications that ends next week. Prairie State College has also a free dental exam program for children. Please call the phone number listed on this slide if you'd like more information. There is an upcoming Family Wellness Expo at South Suburban College. Oh, tomorrow. I'm thinking it's next week. My goodness, the time is just going fast. It is next week, as well as a youth expo coming up April 14th at the Tinley Park Convention Center. There's some good things coming our way. And I would like to welcome Avi Joseph to the stage for the communicable disease update. Hi, Avi.
Hey, can you hear me all right?
Sure can.
Great. Are you able to advance my slides, Kelly?
Yes, can.
Okay, great. Well, I guess I'm Avi Joseph. I'm with our communicable disease unit, and yeah, just gonna talk through some of the communicable disease happenings in Cook County. So you can go to next slide. Um, as always, starting off with just some updates from our respiratory dashboard. You can go to the next slide. So this is just our landing page where we kind of just have an overview of our, big three respiratory pathogens. So you can see that, good news for the most part. COVID activity is actually minimal now. Flu is down to low after, it had been pretty high earlier in the season. Do just want to note that we unfortunately reported our third pediatric flu death of the season, so still, an indication that this was a pretty severe flu season, both nationwide and here in Cook County. And RSV is actually still moderate and is still kind of leveling off, so definitely going to focus on that. Can go to the next slide. So here you can see the percent of ED visits that are due to RSV. You can see from that graph on the left that last season was actually more severe, but you can see that we're kind of maintaining this kind of higher level for a bit longer than we did last year. And if you look at that group, that chart that's splitting it out by age group on the right, you can see that this is primarily driven by our youngest kids, age 0 to 4. That's who's kind of primarily going to the ED for RSV. Can you go to the next slide? And here, just looking at our lab data, it's kind of showing the same thing that RSV percent positivity is kind of leveled off. Did just want to note that chart on the bottom, which is looking at counts of each influenza subtype. You can see that the beginning of the season was kind of dominated by flu A, and then like we've started to see a little bit more flu B, which is that kind of teal blue color. So that's pretty expected. Generally, flu A peaks earlier in the season, and flu B kind of peaks towards the end. But yeah, definitely, as Kelly had said, if anybody that needs a flu shot, definitely still not too late to do that, and there is still some flu activity going around. You can go to the next slide. And then again, this is pretty similar to one of the previous ones, just looking at inpatient admissions due to RSV rather than ED visits. So you can see again, not as severe as last season, but still, um, kind of a more extended, flatter peak. And then again, our youngest kids, 0 to 4, are kind of the ones who are driving inpatient admissions as well as ED visits. And go to the next slide. This is just looking at COVID ICU admissions, comparing last year and this year. So you can see it's pretty similar across both years. Can do next slide. And then next slide. So one of the interesting things in the world of communicable disease recently was this outbreak of Shiga toxin producing E. coli, which was linked to um, cheddar cheese from this farm in California called Raw Farm. So there's actually been 7 cases across 3 states who have become ill with this particular type of E. coli from September until February is when the most recent case was reported. So 4 of those 7 cases are children. STEC tends to be more severe in children, and 2 of those cases have been hospitalized. Um, Most of those cases do reside in California, and of the 3 who have been interviewed, they actually all reported eating unpasteurized cheddar cheese from Raw Farm in Fresno. Um, and they were able to do genetic sequencing on kind of samples that they provided, and it showed that the bacteria was pretty genetically similar among all three cases. So Raw Farm has actually continued to sell their product and hasn't elected to pull it despite FDA recommendation. They say that there hasn't been any positive tests like of their cheese samples itself, so they don't feel like they have to. Um, but yeah, unfortunate because a lot of times companies will kind of, proactively get ahead of it and pull products that are linked to outbreaks. And symptoms can be, kind of your standard foodborne illness, diarrhea, cramps, vomiting, fever. This hemolytic uremic syndrome can actually be pretty severe and shows up in children too. So um, yes, I wanted to point that out. I put that infographic on the side because I was actually kind of interested. I didn't really know how cheese was made, but you can see that pasteurization part of the process normally occurs kind of really early on, and in the case of this outbreak, that step was skipped. You can go to the next slide. Another thing that I wanted to note was this decision by a federal judge blocking changes to vaccine policy. So the American Academy of Pediatrics and a few other major medical organizations had filed this lawsuit um, against HHS and RFK Jr. And the judge very recently ruled that basically everything that the administration has done in terms of changing vaccine policy is on hold pending a full ruling by a different court. So that means that the memo that they put out where they kind of took off 6 vaccines from the childhood schedule, that's been reversed. They had replaced this ACIP board, this vaccine review board, with a lot of new people, and a lot of those members have now been sidelined due to this decision. And then basically anything else, kind of related to vaccine changes in vaccine policy. So the downgrading of the COVID vaccine recommendations, the removal of the Hep B birth dose, basically anything that's happened, in the last year has been reversed. So certainly some good news for us in the public health field. And I thought it was interesting that the judge put this quote from Carl Sagan in his ruling, which is science is far from a perfect instrument of knowledge. History is littered with once universal truths that have since come under scrutiny. Nevertheless, science is still the best we have. So that is kind of interesting that parallel of the law and science in terms of, investigation and kind of trying to understand how the world around us works. So yeah, some good news to end with. You can go to the next slide. And yeah, that was everything I had. Again, I'm Avi. I run our enhanced surveillance program. You're free to email me if you have any questions, and if you want to get added to our weekly respiratory listserv, you can email my colleague Courtney. I'll stick around, but does anybody have any questions?
If you have any questions, feel free to put them in the chat. Thank you, Avi. That was great information and a great update. I just ordered some groceries this afternoon and I ordered cheese. So I held my breath a little bit when you said there was a cheese recall. So luckily it's not what I ordered. So that's great to know. Again, if there are any questions, please feel free to put them in the chat. Thank you, Avi, for your update and your information. While we are awaiting any questions in the chat, I'd like to welcome McKenna Mason from the Respiratory Health Association to give us an update. Welcome, McKenna.
Hi, Kelly. Thank you so much for having me, everybody. So as Kelly introduced, I am McKenna Mason. I am the manager of policy and advocacy for the Respiratory Health Association, and I'm going to be talking about a couple of our policy priorities this upcoming legislative session, which includes Rescue Illinois Schools Program and House Bill 4247/Senate Bill 2837. Next slide, please, Kelly. Thank you so much. All right. So Rescue Illinois Schools, as many of you know, is the resources for every school confronting unexpected emergencies or Rescue Illinois Schools program. In 2023, RHA helped launch this along with the Asthma and Allergy Foundation of America. Since its debut, it has helped save the state over $6 million in Medicaid savings. And as many of you know, this equips schools with life-saving asthma medication and provides training to school staff to deal with these emergencies. Below, you can see where state funding for 2023 to 2024 was $2.4 million. 2025 is $2.75 million. And the reason I'm talking about this today is because in the current governor's budget proposal, there is $0 allocated to the Rescue Illinois Schools program. Since 2023, we have helped over 5,000 students experiencing respiratory distress, and 20% of those come from suburban Cook County, outside of CPS, and with 80% of those students returning to class. And 57% of these cases we found going through our data were triggered by physical activity, which leads us to House Bill 4247 / Senate Bill 2837. Will you click next slide, please? Thank you. So alongside the Christopher D. Redding Asthma Foundation, some of you might know Helen Redding, RHA works alongside Representative Rita Mayfield and Senator Adri Johnson to introduce these bills. As amended, they would add language to the already established Rescue Illinois Schools program to encourage schools to provide inhalers in practice fields and gyms, anywhere that students would be having any sporting events. So games, practices, would also encourage trainers to have them alongside, and it would encourage coaches and trainers to receive the training so that they're adequately prepared to handle these respiratory illnesses. Next slide, please. So to help support the funding that we are asking for the state for Rescue Illinois Schools, and to help us push this amendment of House Bill 4247 / Senate Bill 2837, there's a couple ways that you guys can help out. First is register for RHA State Lung Health Advocacy Day. We are going to Springfield on March 25th, which is next week on Wednesday, and we are going to be meeting with legislators to help talk about these programs and give them reasons of why they're important and why they should support them. We are also going to be launching a virtual Lung Health Advocacy Day next on Tuesday, so the day before we leave, for people that are unable to go but would wish to help out, which will provide virtual letters that you can fill out and will send to your legislators explaining why it's, and then you can add your own notes explaining why it's important and letting them know that you support it. Slip letters of support when House Bill 4247 or Senate Bill 2837 are in committee. Currently, they are both on the floor and they're all both passed out of committee. So the Senate bill will pass into the House and vice versa. Contact your legislators directly and ask them to support or co-sponsor. If you can look up your representatives online. The ILGA website has great resources for that, and they have to listen to you because you're their constituents. And if you have any further questions or interested in signing up for State Lung Health Advocacy Day, please feel free to email me. If you are interested in giving testimony over this or other lung health issues in the state at some point this year or within the next upcoming years, also please feel free to email me. And if you guys would be interested in sharing this information with your contacts, with your own personal networks, that would also be incredibly helpful. Does anyone have any questions for me? Okay. If you guys do have any follow-up questions that you're not thinking about at the time, please just feel free to email me, and I'd be happy to send you any of the information that you'd like. But thank you guys so much for listening to me today. And thank you, Kelly.
No problem. Thanks, McKenna. Do you have any flyers or any materials that you can put in the chat if our participants would like to share with their contacts?
Yes, we have a landing page on our RHA website, and so I can drop the link into the chat for everybody right now.
That would be great. Thank you so much. Thank you for that. That was informative, and that was a huge drop in funding from 2 million to nothing. So that is worth the fight. So thank you all for taking up that fight. And I would like to welcome Lacey Oviak from the Epilepsy Foundation of Chicago to talk to us about her organization and their resources for the community. Welcome, Lacey.
Thank you. Thank you so much for having me today. I'm very excited to talk with you all about the foundation. Okay, so my name is Lacey Oviak. I am the Health Equity Coordinator at the Epilepsy Foundation of Greater Chicago, also known as EFGC. Our mission as an organization is to improve the lives of people affected by epilepsy through education, advocacy, research, and connection. I know that many of you are educators and work in a school setting, so you may be familiar with us if you've ever taken a seizure first aid training with us. That is one of our main services that we provide in the education sector of things, which is actually my department. So I'll try to make sure to focus on that as well. But we do also have services for our members, and I'll get into that a little bit on the next couple slides. A little bit more about us. So EFGC is a not-for-profit organization. We serve 44 Illinois counties since 1946. I think this year is actually like our 80th anniversary year, so that's kind of exciting. We offer education, advocacy, and case management for people living with epilepsy, as well as their families and the communities in which they live. There are nearly 140,000 people who live with epilepsy in the Chicagoland area, and we aim to provide one-on-one sessions with our members, support groups for our members, and also we offer social gatherings for children and adults, as well as legislative initiatives to better the lives of people impacted by epilepsy. We also are dedicated to heightening the general public's understanding of epilepsy and educate thousands of school personnel and staff of companies and other organizations every year as well. Next slide, please. So what do we mean by member? Who qualifies to be a member? Anyone who lives with epilepsy in our 44 Illinois counties that we serve, they can be a member with us. So those are the only two requirements to be a member. And our EFGC member programs and services are kind of at the center of the direct services that we provide to individuals impacted by epilepsy. So the continuum of care approach that we do is care and support provided through all of the phases of someone living with epilepsy in their life. This is including navigating their care, their treatment for epilepsy, accessing accommodations and resources that they may need. Case management supports caregivers as well. So anyone who is a caregiver for someone with epilepsy, they can also use our case management services to help them find resources that they may need. Adult members as well, and also members can join when they're kids too. So if you join as a kid, you can be supported through childhood into adulthood, all throughout those phases of your life as you are living with epilepsy. We also do all of our programs and services in a hybrid model. So we want them to be as accessible as possible. So we offer in-person and virtual options. So since 44 counties is such a very large service area, this is especially important because we want as many people as possible to be able to access these services. And someone who's in Greene County, Illinois, of course, they can't be here in person. They can't be physically present. So we want to make sure that as many people can join as possible by having virtual options. We also do have several families who speak Spanish as well as their first language. So we offer programs and services in Spanish and English as well. Next slide, please. So this is kind of a breakdown of the branches of member programs and services. So first, as I mentioned, we have case management, which focuses on general epilepsy support for referrals to support and resources. So this can be either internal to EFGC and the programs and services that we have at our organization, or they can be external. So we have a lot of partnerships with other organizations that are able to provide support. So case management is able to help them with referrals to those organizations as well. They kind of act as a bridge to connect our members to external resources that can potentially help them meet whatever needs they may have at the moment. They also schedule and complete intakes and annual renewals. So they'll kind of have check-ins with members depending on their specific needs. They may have regular follow-up appointments or just one every once in a while, based on whatever that individual person needs at the time. They also support members in identifying those needs, so kind of figuring out what they're looking for, what they could benefit from, and setting goals to then refer them to internal programming or external services. The clinical services that we provide, this is providing comprehensive mental health support for individuals living with epilepsy and their families. Our clinical service staff provide mental health assessments. They help work with members to develop an individualized treatment plan and implement a variety of interventions that are tailored to that specific person's needs. This might include crisis intervention, motivational interviewing, and other evidence-based therapeutic approaches. They may work one-on-one with the clients, and we also have group settings as well. So we'll have like support groups where you can meet with other individuals who have epilepsy as well, depending on the needs for that person. Our clinicians facilitate the support groups and connect clients with community resources that might benefit them for their mental health. And the overall goal is to just enhance their quality of life, provide emotional support, and empower individuals and families who are affected by epilepsy to thrive. The program section is designed to support emotional well-being. This kind of focuses on social activities and events that our members can attend. This is meant to be engaging and promote connection, growth, and wellness. We have in-office programming every week for our adult members, so they'll come in weekly and meet. We have what is called Train Your Brain, which is a meeting that focuses on working on memory skills. Epilepsy can impact your memory and retention of information, so it'll have memory exercises. There's also lunch and connection groups where you can just kind of have time to socialize and have lunch together. And then lastly, there's also community outings that we do. So we'll do different group outings. Sometimes it'll be just adults, sometimes it's just teens, sometimes it's just families, but there'll be different outings that we do for social events like going to a baseball game or going to a basketball game. They've done art classes. We've done camps for in the summer for kids. All of these are different outings or like activities that we do. And then lastly, community engagement. So this is mostly volunteer opportunities. This is kind of a new initiative to open select activities to the broader community. So everyone who just wants to get involved, they can get involved. To kind of facilitate more engagement with EFGC and volunteering. So we're hoping that through having more volunteer opportunities, we can strengthen community involvement, kind of keep making more connections and partnerships with other organizations or just anyone who's interested in being part of EFGC. Next slide, please. So this is kind of just walking through a little bit of how someone could enroll as a member at EFGC. If anyone is ever interested, they could be directed to the interest form on our website as the first option. This is kind of just your standard form. You would just fill out your contact info and what kind of services you're looking for. It'll ask you if you have epilepsy yourself or if you're a caregiver. If you're filling it out on behalf of someone else, it'll ask just basic questions like that. And that is on our website. There is also an option to enter through Calendly for our intake and outreach coordinator. She's the one who kind of is the first point of contact for anybody who's interested in services. So she manages all of those inquiries. With the Calendly, this is kind of the preferred method because it goes directly to her and she'll be able to set up a meeting with you right away. So if you click on that link there or scan the QR code, you can go directly to that and schedule a meeting with her. Third is a direct referral. So that can be done just by contacting our intake and outreach coordinator directly via email or her phone number. You can just immediately reach out to her with her contact information, or in person is also always an option. We are in the office on Tuesdays and Thursdays. Our office is located kind of in the middle of downtown, but our office is open on Tuesdays and Thursdays from 9 to 4. You can come in and just talk directly to her at the office. And the address is on there as well. So we're at 17 North State Street. Next slide, please. Getting into the education side of things. So this is where I work, and also my colleague Alex there. You may have met him before. But the main part of what we do in the education department is free certified community-facing seizure recognition and first aid training. This covers basically all of the basic epilepsy topics that you would want or need to know. We talk about what epilepsy is, what different kinds of seizures may look like, accommodations for people with seizures, and of course, first aid and rescue medication administration, as well as what a seizure action plan looks like. All of this information we cover in the training sessions. And as I mentioned before, I know some of you may be familiar with the training, and Alex, he leads many of the training sessions for schools. Sometimes I do them as well. Usually I'll do them virtually, but Alex, he's all over the place, driving to schools all the time to do these trainings. So, we've also trained various other organizations as well. For law enforcement clinics, we've done just general like public trainings for if there's any community programming, like at a library or at a college campus. We've done those. The group that we train the most, though, is definitely schools, in part because of the Seizure Smart School Act that mandates seizure first aid training for school personnel to keep students with epilepsy and seizures safe. We also, next slide, please. We also do host webinars and events to kind of promote epilepsy awareness and education on various different topics related to epilepsy. This is open to everyone, just anyone in the public who would like to learn. You don't have to be a member. And a couple of our past events to just highlight on there, they focused on medication navigation. So with epilepsy, there are many different seizure medications that you can take. So we talked about how to navigate those different medications, insurance coverage for different medications. So that was one of the webinars that we've done in the past. Care accessibility, how to get connected to an epilepsy center, what an epilepsy center is, and empowering patient discussions on seizure mortality. That was another recent webinar that we did. So for all of these opportunities, we invite medical professionals, so people who are experts in the field, neurologists, epileptologists, we'll invite them, and they are able to lead the presentations and then have a Q&A session with the audience as well. So it's very patient friendly. We talk about how it's a patient-facing presentation, so they're able to ask questions and just kind of present that information in a way that's easy to understand for everyone. There's also the Caregiver Epilepsy Education Series, also known as CEASE. This is a public Zoom-based educational resource, also free for caregivers of people living with epilepsy. There are I don't remember the exact schedule for the meeting. I believe it is monthly that they have a CEASE meeting. But at these meetings, there will be various public partners and agencies that present on their resources each month as well. And then lastly, our annual education conference, I would like to highlight. For every November, we have an education conference. This is in person. It's a really great event. We have tabling with different organizations who share their resources at tables, and all of those kind of webinar presentations, except live in person. It's really great. There's a ton of epileptologists who come and lead presentations. It's a really great event. And there's also another education conference annually for our Spanish-speaking families. That was actually just recently this month on March 7th. We had an education conference, epilepsy education conference in Spanish language. Next slide, please. And then I also just wanted to take a moment to highlight some of the common challenges that people with epilepsy may experience. We do talk about this more in the training to kind of give an idea of what some challenges that students with epilepsy may experience while they're at school. The academic focus is typically what we discuss when presenting the first aid training for school personnel, but you can also think about these challenges in the context of work or just day-to-day life as well. So one big point up there that I mentioned previously is memory. Epilepsy does impact your memory and retention of information because the seizures can affect those areas of the brain, which, as you can imagine, can cause a lot of stress and frustration. So to perform your best academically and at work, memory can oftentimes play a big role. So it's really important to have necessary accommodations for memory in school, at work. And one of the examples that we say for at school is if a student with epilepsy perhaps has seizures that prevent them from getting all of the information in class. They might benefit from having a designated person who can share notes with them or just keep them updated on any information that they might miss. So that's just an example of one of those kinds of accommodations. From a social perspective, there are also challenges with feeling isolated and mental health challenges as well. There's a lot of stress and anxiety that can result from living with epilepsy, not knowing when your next seizure will be, as well as the medications can sometimes have many side effects that cause drowsiness. It can cause mental health challenges with depression, anxiety. These are all just important to acknowledge as well. Sometimes the areas of the brain that are affected by the seizures might control mood. So that does cause people with epilepsy to be more prone to have anxiety and depression. Next slide, please. These are our seizure first aid posters that we have available on our website in, I believe, 9 different languages. These are free to download and print. If you ever want these posters as well, feel free to reach out to us directly. We can either mail them or you can print them off from the website. These are just nice to have in the classroom or just anywhere we might want to have this hanging up. Next slide, please. And then this is just a list of epilepsy resources, just some links that may be helpful to you. One of them discusses the Seizure Smart School Act, so just kind of all the information on being compliant with the Seizure Smart School Act, what it covers. Our website is up there, and as well as the Epilepsy Foundation National Office's website that can be used to locate your local office. In the case of, I think, everyone here, it will be us, but if you ever have someone from another state who's looking for an Epilepsy Foundation office, that is the place to go, and it will help you find the one that's closest to you. Next slide, please. And one last quick slide is contact information. So on the left there is education in your community. So if you ever want to schedule a seizure first aid training at your school or in your community, anywhere that you would like to schedule one, Alex Houston is our community education specialist. It's either going to be him or possibly me leading the training, but you can reach out to Alex at his email there or call. Also, if you scan that QR code, it will take you to a Google form that you can fill out as well. It'll just ask a couple of questions, a couple of dates that will work well for you. And yeah, you can fill that out and we will get a training on the books for you. And then on the right side there is our intake and outreach coordinator, Abby. So if there's ever anyone who you know who may want to be a member, or if you yourself would like to be a member, you can reach out to her directly or set up a call at her Calendly there with the QR code or that link. And then in the middle, that's just our website. So yeah. And thank you. If anyone has any questions, happy to answer.
Thanks, Lacey. That was really great information. Feel free to come off mute or put your questions in the chat. I do have a question. Are there any age requirements to the trainings that you conduct?
We are able to do trainings for a younger audience as well. We're kind of able to modify it so that it's for an age appropriate level. But yeah, we've done trainings for like younger kids and also high school at a high school level too.
Thanks for that. Stacy, are there any questions in the chat?
No.
Okay. Well, you still have a few more minutes to ask any questions that you may have. In the meantime, I'd like to thank Avi, McKenna, and Lacey for taking the time out of their days for providing this great information for the community. And I'd like to thank you all for attending. I know spring break is upon us and you are ready to clock out and run for the sunshine. In the meantime, feel free to scan the QR code for our webinar for next month, where we will have American Red Cross and someone from the South Suburban Special Recreation Association to talk about their offerings for the community. I'll give it a couple more minutes for questions. And I would like to once again thank everyone. And for those who may have joined late, we are at the finale, at the finish line with the CEUs. We're making sure that that's getting done. I will follow up with her early next week to make sure they have been sent. And you have my deepest apologies. And I will let you have a few more minutes back in your day. Again, thank you for your attendance and be well. Enjoy the sunshine. Have a good weekend. See you next month.
Thank you.
Thanks.
Thank you, everyone.